Can everybody hear me? Just give me a nod if we can hear us virtually. Okay, thank you very much. We've had some technical issues in the past, but so thanks everybody for being here. We're just going to go around. We're going to do some introductions, but I do want to note a couple of things. First off, if you're online, you're coming in virtually, please sign into the chat with who you are, who you're representing. That would be wonderful, and it gives us the ability to track who's at the meetings. We have a sign-in sheet going around the room here. And then there's a couple of new people. Just want them to just say hello and tell us a little bit about themselves. And that's Ed Talbot and Ginger Ross from New Hampshire Problem Gambling. If you're on, go right ahead and give us a little bit of who you are and your affiliation, what you do.
Thank you. Thank you for the invitation too. This is Ed Talbot. I'm the director of the New Hampshire Council on Problem Gambling. Unfortunately, Ginger is not able to join us today. I would like to tell you a little bit about the council. The New Hampshire Council on Problem Gambling was formed in 1996, run in conjunction with the Vermont Council. In 2009, the National Council said each state has to be independent. We began operation actually in 2013, trying to get the 501c3 restored, got that done. And we've been operating in the state since 2014. We run a helpline across the state, finally received state funding as a result of a contract a year and a half ago, and have been operating on a contract which is $100,000 per year over fiscal year 21, 22, and 23. And that was as a result of the sports gambling legislation.
Thanks very much, Ed. I appreciate that. And sorry, Ginger couldn't be with us, but she's certainly, welcome to join at any time. I think the thing to note is, and one of the main reasons why Ed is here is that connection that we have to gambling, many addictions, and the suicide rates that are involved with that. So I know that you've recognized that, Ed. Thanks for being here. We really appreciate having you. And hopefully,
if I can add just a couple of things,
yeah.
Quickly, I'm sorry, I got interrupted, but problem gambling has the highest suicide rate of all addictions. For years, it's been said it's 5 times higher than any other addiction. A recent study out of Australia said that figure is really between 10 and 15%. And just to give you an idea, suicide ideation, 37% of problem gamblers have considered suicide. 49% are pathological. A problem gambler is one who encounters a problem, whether it's financial, legal, employment, domestic, addresses the problem, and then either never gambles again or returns to gambling responsibly. A pathological gambler is a person like me. I've been in recovery for this addiction for 44 years. I feel I could never go back to gambling because it was never enough money. There was always another chance to get even. So I refrain from gambling at all costs. Actual suicide attempts, 17% of problem gamblers have had a suicide attempt, and 18% of pathological gamblers. And the other reason I wanted to speak to you is that mental health issues certainly play into it. Problem gamblers, of all problem gamblers, mood disorder is present in 56%. 42% have an impulse control disorder, 60% an anxiety disorder, and substance abuse disorder is 76%. So if we're screening and treating especially the substance use disorder, and we're not screening for a gambling problem, we're probably missing something with those percentages. I'd be glad to answer any questions. I put contact information out. I'll put it on chat as well. And be happy to answer any questions. I thank you very much for your time.
Thank you, Ed. Thanks for being here and the addition. Is there any questions from anybody in the council? Thanks again, Ed. We'd look forward to having you back at a future meeting also, as we continue to make these connections. So thanks.
Thank you very much.
So what I'm going to do is we've had everybody signed in that's coming in virtually, but we have a bunch of people in the room here. It's a very well attended meeting, which is wonderful to see. So I'm just going to pass around so all you virtually know who's in the room here in real time. I'm Russ Conti. I'm the mental health coordinator for the Department of Safety, Division of State Police. I also chair the Suicide Prevention Council. I'm very fortunate to have that position and work with all of you. So pass it along.
Good morning, everyone. Mary Forsyth Tabor from Making It Happen. I am also the co-chair for this Suicide Prevention Council.
Hi, Mark Phillips, Executive Director of Safe Schools, New Hampshire.
Lori Warnock, Northern New England Poison Center.
Shamara Simpson, American Foundation for Suicide Prevention.
Deb Baird with Making It Happen, also co-chair for the Survivors of Suicide Law Subcommittee.
Al Carbonell, Hotline Manager, Headrest in Lebanon, New Hampshire.
Good morning. I'm Shannon Morano. I'm a clinician at the PATH program and a member of the SPC Policy Committee.
Hi, I'm Brittany Marshall, and I'm the Administrator of Community Mental Health Services for DHHS. Lisa Fontaine Stories, Coordinator Child Fatality Committee, and also Child and Adolescent Health Public Nurse Consultant, DHHS.
Amy Cook, Department of Military Affairs and Veterans Services, and the co-chair of the Military and Veterans Committee.
Representative Jim McKay, I represent the House of Representatives.
I'm Trooper Seth Gar from New Hampshire State Police.
Good morning, Sean Jones with the New Hampshire Department of Military Affairs and Veteran Services, Division of Community-Based Military Programs.
Good morning. My name is Callie Geiger. I'm an MSW intern here with the New Hampshire Department of Health and Human Services. I support the Suicide Prevention Coordinator and the clinical team at PATH.
Morning, everybody. Jennifer Sabin. I'm the Suicide Prevention Coordinator here at DHHS, and I sit in the Division for Behavioral Health.
Thanks, everybody. And again, thanks for being here. Every meeting we try to have a featured committee presentation from all the great committees and all the work. And that's where the work really gets done. So today, we're going to have Patrick Roberts from the Data Committee. Is going to give us a presentation. So Patrick, if you're all set, I want to hand it over to you.
All right, great, thank you. So as Russ said, I'm Patrick Roberts with NAMI New Hampshire, and I chair the Data Subcommittee. I have a few pieces to talk about, and then we have the more exciting pieces of some guest speakers who are going to talk about some related things. So the Data Subcommittee, we're a small committee. We're made up of representatives from the Injury Prevention Center, NAMI New Hampshire, the Army National Guard, Department of Corrections, Department of Health and Human Services, and when they're available, the Office of the Chief Medical Examiner. So they've been kind of swamped there, so we haven't had them as much, but we're still getting data from them via the NVDRS. Recently, as usual, one of our main projects for the year is the annual data report. So that's something we've been kind of working through. But then we're also kind of in the midst of some new projects, which include working with the crisis text line to get data. And you'll be hearing more about that shortly from one of our guest speakers. And also we're looking at, some of you who've been around longer may remember that about 10 years ago, NAMI New Hampshire worked with the Unite Survey Center to do a part of, to add questions to their statewide poll around suicide prevention. Thanks to the funding the SPC now has, we're able to replicate those questions again. So we're working with getting those into one of the next polls. So hopefully later in the year, we'll have more data on that from the statewide level. Let's see, what else did I have on here? Oh, and several members from the Data Subcommittee, as well as others from the council, are all participating in a community of practice put out by the Suicide Prevention Resource Center. So this is one that's very data focused. So hopefully we're going to have some good information to bring back to the council from that experience there. There's just a few of our work plan items I wanted to kind of highlight rather than going through the full Data Subcommittee work plan. These are the ones that are going to be a little bit more relevant to what I've just mentioned, and also the presentations you're going to hear later. So one of our key work plan items is, again, producing the annual report. So we do that year to year, and each year we try to expand the data we're including into there. One of the items we also have in our work plan is to ensure that that gets out to key stakeholders and expanding the reach of that. So that's something that this year, we're hopefully going to reach out to all of you to help with as well. Just getting this report into the hands of more people that it will be useful for. That includes people who are on the ground, providers, individuals who are doing grant applications, and also our legislators. As I mentioned, we look at different data sources each year. One of those sources that hopefully we're going to be looking at this year is the crisis text line data and that UNH survey data. Those are things that we've not had in the case of the crisis text line ever before, and in the UNH survey data, we've not had that for over a decade at this point. And then one of the other items that we're looking at, still working on this year, is a statewide assessment of needs around data collection and analysis. So this is another item where you may hear from me or others on the subcommittee in the near future around what do we actually need to do beyond what we're already doing. So this is something that we're not looking to solve everything this year, but we want to know kind of where we're at this point. So that's just, like I said, a very high level overview of the subcommittee and some of the key objectives that are kind of related to what we're looking at today primarily. So we have two of our guests, two different groups looking at presenting today. Let's see. So we on the agenda we have our UNH presentation first. I don't know if they're available to stay on a little bit later. I know that Jana has a hard cutoff later today. I don't want to push into that if possible.
Yeah, that's okay, Patrick. They both have a hard stop at 11. So
Okay.
we're just going to do them both. Thanks.
Okay. All right. So in that case, we can stick with the order on here and we'll make sure we get through everything today.
Super. So the evaluation and prevention partnership that's featured with the UNH MSW program is something that I'm really proud of. I am an alum of the MSW program at UNH. My intern is here. We have other students on the call. And so it's just really a great example of utilizing students and their expertise and their desire to, in real time, provide the community with resources that can be used to inform prevention. And in this case, specific to suicide prevention. And so I partnered with their professor, who is a friend of mine, and said, we have this data around the Youth Risk Behavior Survey, which is a survey that's given every other year in high schools across the country. That data is available at a state aggregate level so that high levels of confidentiality and privacy are maintained. And that data is available publicly by state from the CDC. So the students at UNH were able to access that data and look specifically at the questions related to suicidality, all the way from a change in behavior due to feelings of sadness and hopelessness, all the way up through a suicide attempt that required medical attention. And so sort of the continuum of suicidality in between those things. And so I'm going to let them walk you through their actual study. This is something that they did for their master's level class. And really the whole point of that evaluation class is to use data to inform practice and have your practice inform the data that we collect, right? And so sometimes in university and in master's programs, we sort of run things on data sets that feel less relevant and are sort of just the data for data's sake. However, it was really important to me in my first year as a suicide prevention coordinator to really dig into this data that we already have, to look at what we could be doing more as the suicide prevention community in order to inform our prevention efforts. And so Joe and Jess, I'll hand it off to you. Feel free to do a brief intro and then dive right in. I will say it's sort of a data heavy meeting. So it's, nerd out with me if you can, and, make your to-do list if you don't want to. Thanks.
Good morning, everyone. So good to see you all here today. My name is Joanne Coles, and I'm here with Jessica Goff. We're MSW students at UNH in our final semester. We've got like 3 more weeks to go. We're here to present this important data that we did some good work around. So we're excited to be able to share this with you. We completed a chi-square analysis looking at 6 YRBS questions and how they related to the independent variable of sexual orientation. And as Jennifer had said, the questions range from symptoms of depression at minimum, such as feelings of sad and hopelessness, to active suicidality and having really extreme outcomes of that. So today I come to you as a UNH MSW student. This topic is important to me because I've worked with this population of youth for the past 21 years as a direct service worker for DCYF. And I also identify myself as LGBTQ+ and have witnessed the specific challenges that this population faces. So the information today that we'll be presenting can help us be greater attuned to the needs of this population, and in turn can assist us all collectively within our systems to work together to improve the safety and well-being for this population. Jess.
Hi, everybody. It's nice to be here. My name is Jessica Goff, and I am an MSW student with UNH, as Joe mentioned. I am also an intern with Seacoast Outright, and I see Hershey here today, our executive director, who's going to give you some context later, which is great. Hi, Hershey. So yeah, I'm happy to be here. This interest also lies for me in my internship and my work with youth, and then also in my own identity. So we're very happy to be here to share this data, and definitely feel free to ask us questions as we get to the end. Alrighty, so we're going to start here, providing a little bit of context for our data. So our data today focuses on LGB youth, which focuses on sexual orientation. So I really wanted to lay out the difference between sexual orientation and gender identity. Unfortunately, we didn't have access to data regarding the gender identity of youth in New Hampshire, so we weren't able to run that data. So our data today focuses on youth's sexual orientation. So sexual orientation defines who we are attracted to. This can include being attracted to people of a particular gender, of multiple genders, or of no genders, because some folks are not attracted to anybody. So for our purposes today, straight is generally defined as being attracted to the other gender, which we can break down later. Gay or lesbian is defined as attracted to the same gender. Bisexual is generally defined as attracted to both the same and different gendered people. And not sure likely means people who are questioning, who didn't feel like they fit into any of those categories. So it's important to keep in mind that these definitions really do evolve over time. And there are a number of other identities that weren't included here that youth didn't have the opportunity to identify. And so in terms of gender identity, that really defines people who are cisgender, transgender. It's our innermost concept of who we are as a man, as a woman, a blend of both, neither. It's really how we perceive ourselves. So again, today's data does not look at transgender youth. It doesn't look at gender identity, unfortunately, but we are focusing on youth who are straight, gay, bisexual, or who identified as unknown or not sure. Great. So most of the national research at this point really loops children together as LGBTQ+. So again, this is including that gender identity piece. But we do know that 42% of LGBTQ+ youth ages 13 to 24 considered suicide in the last year, and 62% reported symptoms of major depressive disorder, which is a startlingly high number. So as we go down to a state level, according to the 2021 Trevor Project National Survey, 75% of LGBTQ+ youth in New Hampshire have experienced discrimination based on their sexual identity. And this is really important because we know, according to the minority stress hypothesis, we know that being victimized leads to higher rates of depression, suicidality. We know that it's a risk factor. So LGBTQ+ youth do face high levels of discrimination in New Hampshire, including in New Hampshire schools. And this data was from last year. So this is also important. Alrighty, so for the data that we ran today, again, our sample was from the YRBS survey. So we didn't collect the data, but we did run analyses on the data. So this data was collected among 13,710 participants in New Hampshire schools who were aged 12 to 18 years old and in grades 9 through 12. So of the youth who responded to the survey, 84% identified as heterosexual or straight, which was around 11,000 youth. 2.3% identified as gay or lesbian. 9.3% identified themselves as bisexual, and 4.4% said that they were not sure. And there were also 250 youth who did not answer. So as you can see on this pie chart, this is the percentage of kids who identified as each sexuality on the day that they took the survey. You're going to be seeing this chart compared to others in the following slides. So if this pie chart was the exact same as the others that we're going to show you regarding risk, then we would know that there was no impact on suicidality from sexual orientation. But if the pie charts are different, we will know that there is a disparity in the data. So if all things were equal and there was no risk that came with sexual orientation at this point, then the charts would look exactly the same. But if they look different, it means that there's just a disparity. Alrighty, so here are the analyses that we ran. So the questions that we asked ranged from, during the past 12 months, did you ever feel so sad or hopeless almost every day for 2 weeks or more in a row that you stopped doing some usual activities? And this was aiming at depression. The next question was, during the past 12 months, did you ever seriously consider attempting suicide? So we have considering. The third question was, during the past 12 months, did you make a plan about how you would attempt suicide? The next question was, during the last 12 months, how many times did you actually attempt suicide? So now we're elevating to an actual attempt. And then the fifth question was, if you attempted suicide during the past 12 months, did any of those attempts result in an injury, poisoning, or overdose that had to be treated by a doctor or nurse? And then we asked a sixth question, which was just a question of interest regarding, during the past 30 days, did you ever sleep away from your parents' or guardians' home because you were kicked out, ran away, or were abandoned? And we were curious how this would impact the data, so we ran that as well. And I will hand it over to Joe to look deeper into the data.
Thanks, Jess. So I just wanted to make one little caveat. The pie chart, there's a little typo. It says 82% and it's actually 84%. So those of you who noticed that in one of the previous screens, I just wanted to point that out. So this graph shows that, so we kind of broke it down from question to question, just to give you a visual representation of what a normal distribution would be. So on the left, you see it says 82, but it's actually 84% of the youth who took the survey identified as heterosexual. And then the other various categories, the orange being 2% of the population, gray being 10% of the population is bisexual, identifies bisexual, 4% identified not sure, and then the lighter blue, 2% missing. So during the past 12 months, did you ever feel sad or hopeless almost every day for 2 weeks or more in a row that you stopped doing some usual activities? You see on the right that the percentages of youth who identified as heterosexual, only identified 13% of them identified as sad or hopeless. So there is an unequal distribution. So the pie chart on the right shows that out of 100% of the youth who said they feel sad and hopeless, 30% of the youth who had said yes, they feel that way, identify as bisexual, which is disproportionate in that only 10% of the youth surveyed are bisexual. Okay, and so 25% of all youth who said yes, they're gay or lesbian, which is disproportional in that only 2% of youth surveyed identified as gay or lesbian. So this shows a disproportionate number of gay, lesbian, bisexual questioning youth that are prone to symptoms of depression compared to heterosexual youth. So this disparity in the data shows that the kids who are not straight have a disparity in the aspect of their behavioral health Next slide. So this chart shows that during the past 12 months, did you ever seriously consider attempting suicide? So you see the same data from a normal distribution here. We see on the right the actual outcomes of this question based on the population that took the survey. So you see that this pie chart shows that 32% of all youth who identify as bisexual is disproportionate, and that only 10% of youth who surveyed are bisexual. And 24% of youth who said that who identified as gay, that's a huge number compared to what the normal distribution is for that population who took the survey. So heterosexual youth are less likely to seriously consider suicide in comparison to gay, lesbian, or bisexual individuals. And what we found really interesting was that the percentage of bisexual youth was actually greater than the percentage of gay or lesbian youth, which we found really interesting. And in addition, the individuals who answered not sure really raised a lot of questions for us in terms of, who is identifying as the not sure category. That could be a population that we could identify if we had better data. So if the question of gender identity was included in the YRBS survey, that could flesh that out a little bit. Next slide. So the next question, during the past 12 months, did you make a plan about how you would attempt suicide? You see the percentages here even greater for all categories aside from heterosexual. And the missing category is a little bigger here too, but 21% not sure, 33% bisexual, and 24% gay or lesbian. So those are large numbers. And these are not surprising numbers in a way, but again, it really raised the question of kind of what's going on for bisexual youth. And because we were surprised that there would be a discrepancy between different categories of sexual orientation. And again, it raises the question about the not sure category. Next slide. And during the past 12 months, how many times did you actually attempt suicide? These were very large numbers. The percentage of missing and not sure data increased for this data set. If there was more specificity to the YRBS demographic selections, perhaps a greater understanding of the risks for other sexual orientations or gender identities could be captured, which is not in this data set.
And this data was looking at 6 or more attempts. So you could see that of the youth who said that they had 6 or more attempts, a very large proportion were not straight. Only 4% of the people who had 6 or more attempts were straight. So we can see that's a huge discrepancy, as Joe said.
Next slide. So the fourth question was regarding the number of suicide attempts for each sexual orientation in the YRBS. So the blue is the percentage of youth who attempted 1 time. Orange is the percentage of youth who attempted 2 to 3 times. Gray, 4 to 5 times, and yellow is 6 or more times. So you can see that the number of gay, bisexual, or questioning youth have attempted suicide at higher rates. And this analysis is important because it demonstrates that non-heterosexual youth actually attempted suicide during the past 12 months. Next slide. So this pie chart shows that out of 100 youth who said yes, that they had a serious attempt requiring medical intervention in the past 12 months, 25% of all youth who answered the survey were bisexual, identified as bisexual. 21% were gay, 29% questioning, and 6% heterosexual. This shows the disproportionate number of gay, bisexual, and questioning youth in the general population. And this shows another way of looking at the same question as the last slide in those that youth who have serious attempt that require medical attention are gay, bisexual, and questioning youth. They're more than 3 times more likely to attempt suicide with serious injury that requires medical intervention. Next slide. So this is one data set that we actually, we kind of threw in there. We weren't going to do any more, but we found this one was really interesting to use in this actual study. During the past 30 days, did you ever run away or sleep away from your parents or guardians because you were kicked out, ran away, or were abandoned? We know that LGBT youth are often not accepted at home. There is a higher disproportionate rate of LGBTQ youth who are homeless. And so this was very interesting to us as well. So this looks at, the population that identified as bisexual. 21% of them said that they did in the past 30 days sleep away from their parents because they were kicked out, ran away, or abandoned. 19% gay or lesbian, and 26% not sure, which again really raises the question about, are these youth, our transgender youth, are these youth, the youth that aren't being counted because they're not comfortable to share their identity. Okay, yes.
Thank you, Jo. Yeah, so we looked at, in looking at this data, we recognized a few limitations. So this is the best data that we have in our state right now. The sample size isn't huge, but it is for the number of high school students in our state. So it is a relatively significant number, but schools are able to opt out. So it's not a perfectly representative sample. We know that our data also underrepresents the kids who died from suicide. So specifically in that question of an attempt that leads to serious injury, those youth who that injury was serious enough that they unfortunately passed away are not going to be represented in this data. So if we know that LGBT youth or LGB youth seem to be more likely to attempt to have serious attempts, then we may actually be underrepresenting in that number because they also may be more likely to pass away, but we weren't able to look at that. There were also some questions with no answer, as Jo mentioned. We're not really sure what the not sure category was encompassing. And then also an unknown opportunity for consultation post-survey. These questions could bring things up. I know many schools provide that opportunity, but we did want to mention that. Great. So our findings do demonstrate a risk of depressive symptoms, suicidal thoughts, and attempts among lesbian, gay, bisexual, and questioning youth in New Hampshire. We really do know this to be true, and I know Hershey will speak to this later. We know that this is the case, but having this data is really compelling as well, in that we also know that it's happening in New Hampshire. It's not just national numbers that we're basing our decisions on. But a recent Gallup poll of telephone surveys in 2021 showed that 1 in 5 Gen Z adults identify as LGBT. So we're talking people born between 1997 and 2003, and this is up from 10% among millennials. So we know that the rates are increasing, especially among young people. So it's really important for us to make sure that in our efforts for suicide prevention, we're really addressing the needs of these kids. It's also important that we recognize the signs of depression and suicidal ideation. I know you're all aware of that and taking concerns seriously. It's also really critical to be accepting. We know that youth that say that they have at least one accepting adult in their life are 40% less likely to report not having attempted suicide. So we know that being accepted is really critical in schools, at home, and in different settings. It's important to advocate for acceptance and inclusion of LGBTQ+ youth. As I mentioned, bias plays a huge role in well-being, and it's really critical that we're all great advocates. And just to remember that not all LGBTQ+ youth struggle with mental health or suicidality. There are increased rates, but that doesn't mean that all youth are going to struggle with this.
So we looked at next steps. How could future research evaluate and continue to look into some of these questions that were raised. How caregiver involvement and youth perception of belonging could mitigate youth risk of suicide and possibly running away. Collecting data for sexual and gender minority populations on a voluntary basis could help identify health disparities. How do schools, agencies, and communities support youth and their caregivers in celebrating sexual diversity during this dynamic stage of adolescent development? Realizing how intersectionality also compounds risks in many areas is important to consider. And according to the YRBS data, we know that youth who identify LGBTQ or LGB are at greater risk of symptoms of depression and suicide, as well as being kicked out, running away, or being abandoned by caregivers. How can we strengthen those families? How can we strengthen those youth so that they're feeling comfortable in their own identities? So collecting data on this vulnerable population is important towards identifying some of the challenges this population faces, and also figuring out ways that systems can be working together to support these youth and support these families so that we can decrease risk for them. So could the YRBS data capture more specific data for transgender and non-binary youth in order to assess the challenges and risks for this specific population? Currently, this data is all blended in a not sure category. And so it really raised, what can we do about that? How can we be able to address this in our own ways, in our own systems? Even July 2021, the Census Bureau began collecting information on sexual orientation and gender identity. So I think that's really interesting. So it seems like we're going into that direction. But given the key role of data collection in virtually every aspect of resource allocation and decision-making, failure to include these things in surveys that collect demographic data can really result in negative consequences for this population. Some food for thought. Any questions?
Looking through all of those pie charts, I know it can be tough to sort of reflect what people are seeing on the screen. We do want to have some time for questions and have our presenters answer. Jenny O'Higgins is on Zoom to help me with any questions that come into the chat. So feel free to raise your hand physically or on Zoom. I'm going to pass it over to Representative McKay to get us started.
Thank you very much for a very interesting presentation. In the legislature, there is considerable concern about these questionnaires, particularly from the Department of Education. There are questions like, does your mother or father assault you physically or sexually? And these kind of questions, which are very important. But as you can see, a certain part of the legislature has a fit about that. So I'm intrigued as to how you got this system to work, because maybe we could do something. We have a very small group in the legislature, which is a gay, lesbian, I forget all the initials, BTQ and all of that, of which I'm a member. That we would be very interested to hear this presentation. The Health Committee, which I'm on, is now finished for its year, so we can get on to other more important things than what we've been doing, frankly, so far. So I'm very impressed. I also taught at UNH's Department of Social Work for about 8 years. And so it's great to hear that the department is taking on such an important role. In the past, they didn't. The other issue that is very important in mental health is the training of people, particularly social workers, because I'm prejudiced, of course, but that there's a major problem in the Department of Health and Human Services NAMI, all over the place. All of the mental health centers have major lack of professionally trained individuals. So whatever we can do to increase this interest in the university system, it would be great. So this is extremely pertinent information.
Thank you so much. We think so too. And I think that this is a good opportunity for different groups to really support if there are bills that are going to be heard, to be sharing that anecdotal information about what you know when you see, you know, boots on the ground in the field, also from a research perspective, and really showing up at some of these hearings. I just saw in the chat that there is an executive session tomorrow being heard. I'm going to check out that House Bill 1639. And if some of this data could be provided to them, I'm sure Jess and I could figure out a way to show up for that hearing.
Yeah, Jenny and I can help with that as well.
Great.
That bill is pertinent to the collection of this youth risk behavior survey data. The only thing that wasn't mentioned that I'll just clarify is the most recent data that was available was 2019. So that's what we were looking at. So you think about the experiences that have compounded young people since COVID, the data might actually continue to be underrepresented in that way. And so just another really interesting point. I do know that Deputy Commissioner Brennan is on from the Department of Education. I don't know if you want to respond to Representative McKay. Give Christine a second. If not, maybe Lisa. I see that you have your hand up as well. You want to weigh in from the Department of Ed?
I do, but I'm not sure what the actual question is. So I'm so sorry.
Yeah, that's okay. Representative McKay had asked about the Department of Education's sort of perspective on the youth risk behavior survey and its administration in schools.
Okay, so I'm at the Office of Social and Emotional Wellness, and I know that we're very, you know, we follow the laws and we follow the regulations. So I think we're waiting to see what will happen as a result of HB 1639. So I'm sorry that I don't have a more specific response.
Sure. We're just waiting to see what the legislature is going to do, just as Lisa said, and then we'll follow it. We don't take positions on bills going at the department.
Great. Thanks for that clarification.
But I do have a question.
Yeah, I'll just stay on this thread for one more second. As you did notice in those pie charts, the scaffolding of risk as it sort of increases in intensity, you can see that young people choose to stop answering, right? So this idea that young people are sort of using the survey in a way that is untruthful, or they're sort of making things up, right? That's been shown to not be true. They're just as likely to answer surveys honestly as adults. And so that section of missing data started to increase as the scaffolding of risk increased. And so that's just another thing to sort of notice, that when young people get uncomfortable with the question that's asked, they just don't answer, right? Go ahead, Lisa.
So one of the interesting things about the YRBS, and not that we can change it, is that we only ask about birth gender in terms of male or female, not in terms of the intersex, which we know is roughly rounded up to 2% of the general population, regardless of where we are on the globe. And I don't know that anyone would know anything, but I'm really, whenever I look at the YRBS data, I wonder how that intersects with some of the results we see, whether it's about LGBTQI+, and because they tend to have higher risk factors across the board, not just in terms of you know, suicidality. So I just wanted to put that out there as a thought about the data and the limitation.
Yeah, thanks, Lisa.
Thank you.
Any other questions before we move on? We'll have time at the end of the agenda as well for continued discussion. So in case you think of something as we continue with the presentations, I think it's so great to have you here, both as students, as members of the LGBTQ community, to present this data to us, to say, you all really need to make sure that your prevention is culturally relevant to us and to young people in the state, because it really matters. And so you did receive a formal invitation to present at the legislature, and we can help prep you for that if that's something that you're interested in doing. But thank you so much for your time this morning.
Thank you for inviting us. We really appreciate it. It's a great opportunity, and also it brings more meaning to us as students to be able to do something in the classroom that is actually applied. It really makes a big difference in terms of really connecting what we're learning to real life circumstances. So we appreciate the opportunity. Thank you.
Thanks. Okay, Patrick, back to you.
Right. So as I mentioned briefly earlier, we have a partnership with the Crisis Text Line. This is thanks to the funding the SBC has received. And today we asked Jana French to come and just give us a kind of brief intro to the Crisis Text Line, the data that we're going to hopefully have access to this year, and maybe how some other states are using some of their data. We're also looking at having Jana come into the May data subcommittee meeting. So we'll be able to have a more in-depth meeting there and hopefully have more discussion at that time. So this is kind of to whet your appetite for that, and everyone would be invited to that meeting as well. All right. Jana, we'd love to hear from you now.
Awesome. Thank you all so much for having me this morning. Like Patrick said, my name is Jana French. I currently live in Brooklyn, New York, but I'm actually visiting my parents in Tampa, Florida. So you'll have to excuse kind of a little bit of the out of office look. So I'll be presenting today a little bit about what Crisis Text Line does, and then some of the stuff that we share with you all through our partnership. Great. So Crisis Text Line, we envision an empathetic world where nobody feels alone. We provide free 24/7 high quality text-based mental health support and crisis intervention in both English and Spanish. We're available all across the country by texting 741-741 in English and in Spanish. You can text OLA to 741-741 and it'll route you right to our Spanish folks. We're also available in WhatsApp, and those are our WhatsApp numbers right there. One note on our Spanish service is it's in a fully acculturated service. So when somebody texts into us in Spanish, they'll be connected with one of our bilingual crisis counselors who's being overseen by bilingual staff. So they have gone through a specific training that's related to Spanish speaking cultures. So when anyone texts in, they're going to receive 3 levels of support. The first is our crisis counselors who engage in active collaboration. These are volunteers who are also located all across the country. They go through 30 hours of training and a background check. And the training covers things like active listening, empathy, collaborative problem solving, and risk assessment, things that we know can apply to any of the crises that people reach out to us about, because we really see the gamut at Crisis Text Line. It's everything from I'm stressed out about finishing my math homework to I am in a fight with my best friend, and so I don't know who else to talk to today, to my parents are mad at me and I'm not really sure why, to I'm thinking about suicide, I'm experiencing domestic violence or other more imminent type issues. All of our conversations are also overseen by one of our clinical staff. These are also people located all across the country. They are on staff and they have a LMSW or something similar, or an equivalent experience in crisis service. Some people we work with have like 20 years of working on crisis lines. We consider that the same. And then the third thing that we have is our machine learning algorithm that we've patented. This helps us triage our texture queue based on the words that people use when they first reach out, so that we can make sure we're reaching the most imminent risk texters first over folks who might be texting in about their homework, which is also something we want to get to them as fast as we can about, but they can wait a couple more minutes. So like I said, when somebody texts in, they send us a message, they'll start by getting 3 automated responses. I mean, we are still also available on Facebook Messenger. So they'll get 3 automated responses. It'll tell them that they've connected with Crisis Text Line. It'll provide our terms of service. It has a message in Spanish that lets them know that if they're looking for Spanish service, how to access that, kind of like a press 1 situation. And then it asks them what's their crisis. So from there, that next message is run through that triage algorithm that I mentioned that helps us determine our most high-risk texters, kind of like an emergency room. So we're getting to the folks with bullet wounds over people with a sprained ankle. Our goal is to connect with all of our texters in less than 5 minutes, which we're able to do the majority of the time, but this makes sure that we can reach our most imminent risk texters in less than a minute on average. So then they'll get a response from one of our volunteer crisis counselors. They will start by building some rapport with the texter, really trying to figure out kind of what's going on. They'll do a risk assessment, and they will also kind of help them move towards a calm, safe place. Sometimes that means that we'll provide them a referral, and I'll get to referrals in just a minute. And sometimes that just means kind of working through what's going on and making a plan for how to feel better moving forward. And then our supervisors. So they see all of our conversations as they're happening. It's message by message. And then in an instance where somebody may be at imminent risk and we are unable to de-escalate them, which happens in less than 1% of our conversations, they'll be the ones who would coordinate with emergency services to send that person help using 911 if necessary. But like I have on this slide here, it's about 2 to 3% of our texters each day are somebody who is at imminent risk. For us, that means that they have the ideation, the plans, the means, in a 0 to 48-hour time frame for harming themselves or somebody else. Of that 2 to 3%, we're able to de-escalate them about 60% of the time. That's creating a safety plan with, at the minimum, they agree that if they feel like they want to go through with their plan again on harming themselves, somebody else, that's another question. But if they feel like they want to act on their suicide plan again, that they would reach back out to us. And then there's a whole other, that's our minimum for that. So then we de-escalate those 60% of the time, and about 40% of those is where we work with EMS. So the resources that we share with texters, it happens about 1/3 of our conversations. It can be part of that safety plan, or it can be just somebody who texts in looking for a resource. We have a vetted list of over 200 resources that today are all national resources. They are in the moment support, so things like 5, 4, 3, 2, 1 grounding and breathing, what I like to call guided self-help, so worksheets that they can work through on something like that they're experiencing. What I have here is the antidepressant skills worksheet. We also have a coming out workbook, things like that. Databases where they can find a service in their area, like 211 or Aunt Bertha, and then online forums where people can share what's going on with people who are having a similar issue. So in the rooms, live well, things like that. And then privacy and trust, these are our #1 priority. We make sure that our users are not charged a standard messaging rate unless if they're on Verizon, Sprint, AT&T, or T-Mobile. Otherwise, we count as a regular text messages, like if they were texting a friend. We make sure that we don't show up on people's phone bills. We know that that's particularly important because a lot of our texters are youth. And so if parents are coming through and they don't want their mom or dad to know kind of what is going on that they're texting about, or if somebody is in a relationship where somebody else is looking at their phone bills. And then we adhere to stringent GDPR compliant internal data privacy and security standards. So to talk a little bit about our data trends that we have from this. So we are the largest crisis texting service in the US. I pulled this data this morning. So we've to date, since we launched in 2013, we've had 7 million conversations with 3.3 million texters. So you see that people reach out to us about 1.5 times in that time frame. We've done 67,000 suicidal de-escalations. This is where somebody came to us at imminent risk and we were able to create that safety plan with them. 60% of our texters share something new with us. So we keep track of this because we like to think of crisis text line as not only breaking down stigma, but also a stepping stone to talking about hard stuff with other people. So we asked that in our post-conversation survey. 87% of our texters found this conversation helpful. And then something else that I pulled for you all is that 72% of our texters are 24 or younger. So we do serve anybody of any age, but you can see here that a lot of our texters are youth. And to give you a sense too of where we get this information from, is from a couple of places. Things like conversations and texters, that's just counting when people text into us. We also get when people text in their cell phone number. So we use their area code and the next 3 digits to kind of get a sense of where people are texting in from. So that's going to be really important when we talk about New Hampshire data. That's how we're kind of getting that information right now. At the end of our conversations, 2 surveys go out. One is to the crisis counselor who took the conversation. They check off any and all topics that were covered. And then the other is a link that goes out to our texters where they can tell us how they think we did, how they feel now that the conversation is over, and any demographic information that they're willing to share with us. And that's filled out about 21% of the time. So it's a sample size, but with how many texters we have, so in our time frame, but in a day we see about 3,500 conversations. It's a pretty large sample size, so we feel comfortable using those insights. And that means too that when people text into us, that we don't ask any questions, we don't have any intake surveys. At the beginning of the conversation, we'll typically ask somebody's first name. They could give us a fake name. We don't care. It's just something to kind of build some rapport and have something to call them by throughout the conversation. So these next few slides, I'm going to breeze through. This is from our Everybody Hurts report in 2020. Our one with 2021 data should be coming out in the next month or so. We're going to launch it for Mental Health Awareness Month. But this kind of shows, we put it out every year and it compares states to other states as far as what we've seen in our data set, what kinds of issues they're seeing, demographics that we see state by state, and things like that. So this is a little outdated now, it's with 2020 data, but we will have it ready in the next month with 2021. So some of the ways that we use this data, we use it to kind of understand how our service is effective, what kinds of people are experiencing crisis across the country and where, when people need the most help, like we have here, people need most help usually late at night. And then what kinds of issues people are texting into us about. And we share this with folks like you all so that you can understand kind of what's going on in your state and make programming decisions or do research or anything else that can kind of help people who are experiencing crisis. So moving on to particularly what we have with New Hampshire, I just pulled this data looking at 2021 specifically. So this is based on people's phone numbers. So this is their area code, and then the next 3 digits kind of help us understand that people are in New Hampshire. Because our texters are young, this is about 80% accurate for if they have a New Hampshire phone number and are still in New Hampshire versus if they moved to a different state with their New Hampshire phone number. I mean, I'm certainly an example. I live in New York. I'm currently in Florida. I have an Atlanta phone number. So based on phone number, we know that we had 4,978 conversations from New Hampshire in 2021. That's from 2,751 texters. We did 30 active rescues. That's where the person was at imminent risk or they had a plan to harm somebody else, and we weren't able to de-escalate them. And then we did 64 de-escalations. So that was where we were able to create a safety plan with them to keep them safe. Our top issues last year in New Hampshire were anxiety and stress, depression and sadness, and relationship, which is pretty standard with what we see across other states as well. So specifically what we have with you all with NAMI New Hampshire, we share with you all a dashboard that updates daily with information about how people in New Hampshire are reaching out about crisis. So this is just a screenshot of it here, but you can see that it has conversations, texters, this is satisfaction rate, and then how often we were getting to our high-risk texters in less than 5 minutes with New Hampshire phone numbers, and volume trends. Some other things that you would see on this dashboard that anyone can log into is you would see demographic information where based on that post-conversation survey, you could see we have a map of New Hampshire that you can see kind of where people are coming from. It's because we use the area code and then the next 3 digits. The next 3 digits gives us a little bit of a sense, because I know that New Hampshire is one of the states that only has 1 area code. So it does have data based on that. And that's a little bit rough, but it gives you a good sense of kind of where in the state people are experiencing more or less crisis, as well as trends. And then one of the other really cool things that it does is it compares your data set to Crisis Text Line's national data set. So you can kind of understand if people are experiencing more anxiety, less anxiety, if you are reaching more people who identify one way than the other. So those are some of the insights that you can see on that dashboard. And that's all that I had kind of prepared for this presentation. Patrick, I'm happy to pull up the dashboard if you want to walk through it. I'm happy to do that, or whatever else you think would be helpful. But this is kind of a quick overview of our partnership and what kind of data is available.
Yeah, I think this is a great introduction to it. And I know you have a hard stop, so I don't want to keep you too far beyond that. But I
Okay.
don't know if anyone has any quick questions. And hopefully we'll have an opportunity to talk to you again in May at our data committee meeting, which is a
Yeah,
smaller
definitely.
meeting where we'll have more back and forth.
Yeah, I can stay on for another 5 to 10 minutes if folks have questions.
Does anyone have any questions for Jana? And I can't see him in the room, so hopefully someone there can cue us on that.
Jana, I have a question in regards to the collection of your data. Do you have any means by identifying your texters as a member of the armed services or a veteran?
In the post-conversation survey, we do ask people if they want to identify as active military or as a veteran. That would be the only way.
Great, thanks. Jana, do you mind unsharing just so we can see some faces here in the room? Thanks.
You got it.
We so appreciate you zooming in on location from vacation. I do think this was really set up to be sort of a teaser for the May meeting, right? Where she'll go line by line with that data and that dashboard at the data committee meeting. Patrick, can you remind us when that meeting is?
Sure, I just have to make sure I'm giving you the right date.
Yeah,
It
no
is towards the
problem.
end of the month, and it's on Wednesday, the 25th.
Great. So I will, lots of folks are asking for the presentation materials, and yes, we will send out everything, and I'll make sure I include that date. All committee meetings are also open to the public and are posted in the legislative calendar as well. And so feel free to join us if you want to really dig in. It's this interesting thing, right, where we have various data sources that in a lot of ways are telling us very similar things. And so, you know, when we look at the crisis text line data, it's mostly telling us that young women in our state are reaching out for help as young as 13 in a lot of cases. And so it's just this really interesting way that we can look at some disparities among the LGBTQ community as well as young people generally. They really do choose different ways to reach out. The other thing that's really interesting with the crisis text line, right, is it's mostly about sadness, anxiety, some problems with relationships. And the interesting thing about that is that young people are reaching out way sooner than adults do, right? This idea that I'm reaching out to something called the crisis text line because I'm feeling so overwhelmed from having a fight with a friend or family member, right? We can learn a little bit from young people to reach out and access resources when those things are happening instead of sort of waiting for our crises to compound. And so just think it's really interesting. And the partnership with Crisis Text Line has been essential as we prepare as a state for 988 and statewide mobile crisis, because right now we don't have access to local texting outside of rapid response, which was just launched recently. So the other really cool thing about the data dashboard is that they allow us to access the data from its inception. So we sort of get the full look back at New Hampshire, not just from sort of the time of purchase, which we're really grateful for. So.
Awesome. Thank you so much, Jennifer.
Yeah. Elaine, did you have a question?
I was just curious, and great presentations today, by the way. Thank you. And because Al is there, I wonder if we know how the text line data compares to what we get in New Hampshire for our call data. I'm assuming text line is probably more of a younger group. And I wonder about the time of calls, the nature of calls. Just wondering if we have any comparison information about the nature of the calls compared phone versus text line.
Yeah, I'll run the mic over to him. 1 sec.
Yeah, off the top of my head, it's actually extremely similar to what we see on the crisis call center. All of the same problems that they're getting through text, we're getting on the call center, and I do believe the callers seem to be getting younger and younger and younger as we get into this. And there's a lot of issues with school, relationships, anxiety, depression. It runs the gamut, and the more help out there, the better, you know. And Headrest right now is in the process of starting a text line for New Hampshire. So hopefully we'll be kind of working at getting more and more data and just have more and more resources for everybody to reach out to.
Thank you.
Question. This is Lori from the Poison Center. We've been looking at increasing our volume of
I think you may have hit mute because I think we're all not hearing you on the Zoom.
Okay, is that better? Much better. Okay, fine. I use my radio voice. Fly me to the moon. No. So at the Poison Center, we're trying to increase our volume of text incoming. And we're getting more calls from healthcare facilities about the younger age group in self-harm, especially with medications. How are you marketing to the text line to that age group to draw them in to use the text line as a vehicle?
Yeah, we do this in a variety of ways. One of them is through some of the other partnerships we have with other states like Vermont. So they have text BT to 741-741. And then that's what they put on all of their billboards that they hand out in the schools so that students know what to text. And so when they do that, it comes to us and it's, it's handled the exact same way that I described. But we're able to track specifically around that keyword, how people are reaching out, and it helps them understand also how effective they are in reaching youth through various methods. The other ways is that we're very active on social media. I had that on my last slide. So we're on TikTok. If you go on there, you'll see me. I did a day in the life video. We're on Instagram. So we do a lot of marketing that way so that we can reach students where they are. I also work with K-12 districts and universities to increase use on their campus. We also have a campus advocates program that is, kind of having youth reach out to other youth about crisis text line. So those are some of the ways that we really get people to reach out. Some of the other things that we do is we really try to put it out there that it's okay to ask for help. And here's some of the scenarios where we can help you out. Because I think crisis can sound really scary, or that can sound also like, oh, well, I'm not experiencing a crisis. I'm just really sad today. And we want to try to kind of break that down with like, literally, we're here for anything. And I love to come to these meetings and talk about the times that I've reached out to crisis text line because my cat was really sick, because my boyfriend was being annoying, like tons of reasons why. And we really want to try to get, like Jennifer was saying, more upstream, where it's like, if you are having a bad day, let's talk about that bad day today so that it doesn't start festering into something down the line. But I would say schools are the biggest place that we've really seen success on getting people to understand. One of the things that I would say too, that is my favorite thing to tell people to do is to put a list of resources on the back of bathroom stalls in high schools and middle schools. That's a place where people might go for a moment of privacy, and it's also sort of a captive audience. The other thing is that we have on our website these posters that have like little tear off tabs, so you can take them with you. So if you print those out and put those in the back of bathroom stalls and then tear off the first one so it looks like they're not the first person to take one, people to put those in doctors' offices as well. And I've heard great success about them just needing to print hundreds. So those are some of the tips that I have.
That's great, Jana. Thanks so much. I've never heard the tear off the first one before, but that seems so effective. Yeah, I'm going to do that now. If I'm ever seeing one where the first one isn't gone, I'm just going to take it. Good one. So thanks again. We appreciate your time. Do want to move on to our next presentation, because the Suicide Prevention Council is really passionate about not just presenting you with all of the troubling things that are happening in New Hampshire, right? We would be amiss if we didn't also talk about all of the really lovely prevention work that is also happening ongoing in our state. And so Hershey is here from Seacoast Outright to talk a little bit about how we as prevention partners and the work that they're doing can really support and advocate for LGBTQ youth in our state who are at all of this risk that we just discussed. So reframe for us, Hershey. Tell us all the good news.
Oh God, I wish I had some. No, okay, we'll try to make this happy. I'm Hershey Hirschkup. I'm the executive director of Seacoast Outright. I use she, her, hers pronouns, and I identify as a lesbian. Seacoast Outright has been around almost 30 years now, and in that entire time, our sole mission is to serve, support, and advocate for LGBTQ plus youth in the Seacoast area. And I will broaden that geographic area to include, during the pandemic, all of New Hampshire and York County, Maine, and at times northern Massachusetts. And as the only organization whose sole mission is to serve this particular group of kids, it's been daunting, especially during the pandemic. We do that by doing two things, really two sides of what we do. One is direct programming. So we offer a youth group, which was online for a good chunk of the last 2 years, but is now back to being live in Portsmouth. And we offer an online game night, and we have a monthly parent or guardian or caretaker of LGBT youth support group as well. You know, we see a variety of kids, everything from, I have a really nice house and incredibly supportive parents, and I'm transitioning, or I identify a certain way and I'm pretty clear about that, and I feel really happy to who I am, to kids on the other end of the spectrum who have some really deep mental health challenges that include depression, anxiety, suicidality, and need a lot more support than actually we can even offer. We also bring in speakers for our kids. We have some annual events like a family summer cookout. We have a poetry slam. We just had an alternative prom that Jess was also at, that had 88 kids show up in formal wear. That was hosted by Community Church in Durham and was a big success. And we're hoping to do it every year as an alternative to the traditional proms that high schools have, where kids can come and feel a lot more welcome and be themselves. And we put on Pride each year in Portsmouth that has about 5,000 people attending, has entertainment, a main stage, and about almost 100 vendors come, which are both businesses, but a lot of our nonprofit partners and supporters and sponsors, including NAMI New Hampshire, Waypoint, Big Brothers Big Sisters, and groups like that. We also have a partnership actually with Big Brothers Big Sisters as a way to reach kids in rural New Hampshire. We're always looking for bigs to be mentors. They don't have to be LGBTQ, just sympathetic, if not empathetic. And that's a way to reach kids who can't make it to meetings. And we've recently started a partnership with the Seacoast Mental Health Center. Part of the problem, and I'm sure you all know this, is that there just are not enough therapists in our area, or even in New Hampshire, who have a particular niche of serving LGBTQ kids, especially transgender kids, and are specialists. And so we're taking an approach of trying to give mental health centers support from one of our professionals to come in and do consultations. So they've hired a former program director of ours, a woman named Sarah Sullivan, who does in fact specialize in LGBTQ youth therapy, to basically work with their counselors. And we're making our way, we hope, through the other 9 or 10 mental health centers, public mental health centers in New Hampshire, to do the same exact thing and use that model as a way for us to provide more care. I have a short list of 6 in my area. They're always booked. They always have a long wait list. On the other side of what we do is community engagement. So often I sit on many committees to be the sort of queer voice and say, don't forget the gay people. So that includes, for example, the Department of Justice Steering Committee on the implementation of WAVA and VOCA grants, Victims of Crime and Violence Against Women Act funding. Also, like Stratford Planning Committee had a grant on seniors, and we helped out with that. So there's a lot of that kind of community engagement. And then Jessica runs our basically educational outreach team. We have a group of volunteers who come and speak, and we do a cultural proficiency training. Some is targeted at, particularly is at schools. So we do a lot of professional development work in schools, but also nonprofits, businesses. We charge a very small amount for it at this point. And Jess has really launched into helping other groups become culturally proficient. We can't provide every service for everything, but we can help other organizations feel confident that they're doing the right thing, using the right language, and providing that service. And that's a great strategy for us. Finally, I'll say, I'd like to say we're a tiny organization with a mighty mission. And what that really means is, honestly, we've been sort of developmentally delayed in that I'd say probably 10 years ago, we should have added much more staff and capacity to our organization to meet a lot of the needs that kids clearly have in New Hampshire that we have not met. And one of those is suicide prevention. We actually had a presentation in a partnership with New Heights, which is now gone, and Chase Home, a residential treatment program in Portsmouth for, I think, mostly high school age kids. And Exeter Hospital funded it. And recently we revamped it with the help of Connor's Climb. So their MSW intern redid it to model it with Connor's Climb's model so that we could offer it in tandem. And we've yet to really launch it. And partly it's just, once again, capacity. So my final pitch will be to say, we could be doing so much more. And clearly our demographic has huge suicide risk, but we just don't have the capacity at the moment. I'm pleased to announce that Jessica is coming on as our community engagement coordinator once she graduates, and is a great contact person if you'd like us to come and do a training for you. We're certainly trying to make our way around state government, local government, schools. The divisive concepts law has not, of course, helped in this matter, and a few schools have shied away from us, but many have just plowed ahead and moved forward with this. So we're really pleased about that. Okay, I'll shut up now.
No, that's great. Thank you so much. I do think
Everybody caught my subtle pitch for funding, right? Everybody got that,
yeah,
right?
I mean, I
all right.
did take a note, of the culturally proficient, how to make sure that SPC is that, right?
Thank you.
So yeah, it's just a great point, right? This idea, sort of a call to action, right? We're all sitting here as suicide preventionists, and we have a community that is under-resourced. And so however you are able, whether professionally or personally, to get involved and support and be an ally, sounds like an open invitation.
Excellent.
Questions for Hershey? Great. I'm sure we'll be in touch as we continue to elevate this voice here at these meetings, and be in touch and really bring Jess and Joe to continue their presentation at different places in the state. So thank you.
Thank you.
Thanks again, Hershey. That was wonderful. Thank you to all the presenters for a very comprehensive view that we like to do at all the full council meetings. Next, we have a date update, which is with us, and I want to turn it over to you, Eric.
Thanks. I think you threw to me. There was a bit of an out there, but I heard my name, so I'm going to assume it's time for me to give an update. What a great meeting this has been. I just want to say, as someone who has recently moved to New Hampshire to be a part of this community, what a great community I have chosen to be a part of now. And so thank you to all of you who have presented today, all of you who contribute to this wonderful system of care. It's really inspiring to see all the great work that's going on. And of course, Beacon is pleased to be a part of that service, where I don't have all the pretty slides that my compatriot Jana had for her service, but I can tell you that we are rather busy supporting the folks here in New Hampshire as well. For the rapid response system at Beacon, we've answered more than 4,000 contacts again for the month of March, which means that that's been a very consistent number for us these first 3 months of implementation, that we're receiving phone calls, texts, and chats in around or in excess of 4,000 per month for this year. That represents around 1,500 individuals that we're assisting. We also were able to dispatch out mobile crisis teams over 600 times in March, which is a slight uptick actually in the utilization of mobile crisis services. It had been hovering closer to 500, but we've maxed over 600 this month. This is a system in growth. I say that in every meeting that I am in, but I really mean it. We are actively soliciting feedback from everyone in the community, everyone who receives a portion of the service, from all of our community partners and other providers who engage with our system of care. And we are actively making adjustments as we go to improve things, to respond to feedback, to make sure that this system is really working the way that the folks here in New Hampshire need it to work. I just want to express my appreciation to all the partners, especially DHHS, who support this program and who have been great to work with, great to partner with. We've been doing quite a bit of outreach these last. We've done significant outreach in the last 3 months, but in the past 2 or 3 weeks, I can tell you personally that I've participated in quite a few events where we're trying to get the word out. We're presenting to various groups around the state. I'm actually in the process of adding 2 people to my team whose sole job will be to do outreach and to host the collaborative meetings that we're having and to support that process. So lots of great work that we all continue to do. Again, thank you all for your presentations today and for letting me be a part of this system.
Thanks, Eric. We're so glad you live in New Hampshire now. Just to sort of round out the update for 988 as well, you may have seen that New Hampshire received some federal funding recently through SAMHSA funding for 988 capacity specifically. And so we're really excited that that money is here and we're working on accepting it so that we can get that work out into the community. A lot of that funding will be used to initiate chat and text at headrest, like Al mentioned, and to also continue to work on crisis collaboration. So we really want to make sure that between the centers at headrest and Beacon, that there's a consistency around experience and follow-up and resources, really trying to not have 2 centers that duplicate their efforts and really streamline and work together. I'm really proud as part of the 988 planning team about how well our centers are working together. I will tell you that in our national conversations, that isn't always the case. We actually have neighboring states where their centers really compete. And so for our centers to be working collaboratively and sharing best practices, we're so grateful to you all about that team approach to making sure that New Hampshire has what it needs. The other thing that is open right now as far as 988 is concerned is an active RFP for marketing and messaging services for behavioral health broadly. If you need, I can include the link to that RFP. We're taking applications through the end of the month. And that's really specifically to aim at how do we help the public understand, to Lori's point, all of these numbers that we're advertising. How do people know when to call 911 versus 988 versus the access point versus 211 versus other places like ServiceLink or their police department directly, right? There's just a lot of options right now for how to access services. And so we are procuring for that expertise because it's certainly beyond my MSW capacity to help people understand. I do like to joke, but it's only, part of a joke that I can hardly explain it, and it's my job to explain it. And so for people in the community, especially during a crisis, think about how difficult it might be to remember what number to call. We are actively planning on the back end to make sure that as folks call various numbers that we're partnering together. The 988 Planning Committee has developed community crisis referral guidelines to make sure that if someone calls 988, but they need 911 or 211 or their doorway, that we're working on those warm transfers as well. One of the things that we heard from lots of people with lived experience is, please stop telling us to hang up and call somebody else because we might have just hung up with them and they told us to call you. So really working on that coordination behind the scenes and making sure that folks get the services that they need. One of the examples I like to use is, if I am experiencing an upcoming eviction, I might call 211 because I think my crisis is housing related. But if I'm in emotional distress, I actually need 988 first, and they need to address my emotional and mental health concerns before we can address my housing crisis. And so making sure that those two networks are working together will be really important moving forward. So that's sort of the quick update for 988 and rapid response. We're happy to take questions on either implementation or feedback, how it's going. July feels right around the corner. So we're looking forward to it. Okay, hearing none, we'll move on.
Thanks, Jennifer. July is right around the corner, and that's going to be a big change for New Hampshire and for the nation, for that matter. And I thank again Eric Eason for not only all his hard work, he's also been an active presenter to the crisis intervention team training program that we have. as we train new first responders and senior first responders. And thanks for your support there. So we're going to move on to just public comment and all any lingering issues that came from the meeting. I want to give everybody the opportunity, but I do want to kick off just one thing. And there's we want to make sure that we're touching on what is, presentations that may be coming from the SBC in the future. So I have one to announce. It'll be going out email via Jennifer, but the First Responders Subcommittee is going to have a successful career workshop based at, just dealing with everything that happens. As you know, suicide numbers for first responders are not good. They are a high-risk group. It is underreported, and it's something we work to change, but we are going to have a great one-day workshop, and that's going to happen on Friday, June 3rd, and that's going to happen at the New Hampshire National Guard Training Center up on Riverwood Drive in Pembroke. It'll all be in the announcement. And great itinerary. We have some great speakers, and it'll just be a good day. And many thanks to what Trooper Seth Garr has done, not only in his career, which has been long, and what he's done as a peer counseling coordinator and manager of that, but also just driving us forward to assure that we have a constant update for this group. So we're constantly updating. And every time we have a meeting, I hear of all the, the groups that we're supporting, and that's really what this council is all about. So I want to make sure that we got that on the agenda here. Are there any questions at all from any of the presentations? If not, we certainly want to open it up for any public comment. Feel free to put a question in the chat if you're a member of the public and wants to comment, address this wonderful group. Heidi, we see your hand up.
I don't have a question, but I do have an update for folks if they'd like to hear that. My name is Heidi Young with the DHHS Bureau of Housing Supports, and I wanted to, some folks already know this, but in our balance of state continuum of care, the region that is not Manchester and not Greater Nashua has put out an RFP for proposals around youth and young adult homelessness. It's a grant from HUD that we received. The full grant was about $2.2 million. For availability for projects right now, we're at $866,074. The April 15th was when we released the RFP. It's out for 30 days. We had an information session that I'm hopefully going to be able to share the recording about. May 13th is when the applications are due by 4 p.m. And projects awards we're hoping to announce by June 3rd. So when Jennifer mentioned the warm handoff piece, there are projects in there that will assist with some of that. The potential of a youth navigation team for similar to supportive services for staff who could take those warm handoffs around housing and be able to hand over those phone calls to mental health centers, but also the connections with housing. So hopefully there's some warm handoffs in that way. So folks can apply for those. It's a supportive services grant. Others can also apply for low barrier crisis transitional housing. There's a host homes project in there, rapid rehousing, and permanent supportive housing. There will be a review team put in place for those, and I can certainly share more information with Jennifer for the notes. So I'm happy to be able to do that, but we're very excited to get this money out, and it's going to be coming soon. So.
Thanks, Heidi. Just a great point. Heidi, I really encourage to attend these meetings because of the overlap between crisis and housing, right? This idea, especially based on, what Jess and Joe presented to us, this idea that homelessness really layers risk. And even if you are not currently experiencing homelessness as a young person, being at risk for homelessness increases your risk for all of these other risky behaviors that we're trying to reduce, right? So a great connection for community organizations to check out that RFP, see if anything that you're currently doing or sort of wished that you could do. Just a really great group came together to think creatively about supporting young people experiencing homelessness in our state. So excited to see some of this money available for work in the community.
I wanted to just mention that our Vermont educator, Gail Finkelstein, has been working with the University of Vermont and the hospital there to create an education program specifically for healthcare providers. And I'm trying to pull it up on my camera now. That will not do it. There we go. So I can tell you the exact title. I've sent the link and the information. It's Preventing Intentional Self-Poisoning in Youth. It's a toolkit for healthcare providers. It's been approved for 2.5 hours of continuing education hours. And I've sent the link and the sort of introductory letter with Gail's contact information to Jennifer and to Mary so that they can share it with the group. We'd love feedback on it. Gail's contact information is on there. She did all the work on it, so I'll turf all the questions to her. But it's in line with what we've been seeing in the way of self-poisoning, in particular in younger and younger kids. So if you have an opportunity to take a look at it, we'd love feedback.
That's great, Lori. Thanks. I've also talked maybe to have Gail and Tom and the group come and present at an upcoming meeting. Tom and I presented for the Vermont Suicide Prevention Coalition at their last meeting. And so just this idea that we're really working between states. Vermont, New Hampshire, and Maine actually have a lot of the same risk and protective factors. And so anytime that we can sort of pool our data and look across and not duplicate, right? So the fact that Vermont has created this really nice toolkit, let's figure out how we utilize it. Because it is specifically for healthcare providers, I will lean on some of our healthcare colleagues to look at it and really provide that feedback. I know that I've asked Jody Harper at the Bi-State Primary Care Association to run it by some providers. Nancy, maybe we'll reach out to you to get it in front of some folks at the hospital, just to see if there's any New Hampshire nuance that we need to incorporate. But really the idea is that, for young kids who are seen at a primary care by a primary care physician post-attempt, how do we know that PCPs are really prepared to address the suicidality that their clients are facing? And so this really interesting and informative education kit has come together. And so we're really looking forward to getting it into the community. Are there any other sort of prevention related events or activities coming up?
I have a very important one. This Saturday is the so there's got to be one in a town near you.
She completely cut out.
Closer.
Like this close?
Like close. Can you hear me now? Okay, I feel like a DJ. Lori, you and I. Okay, I'll say it again. This Saturday is the National DEA Take Back event. There's over 100 locations in the state of New Hampshire. There has to be one close to you. Please think about cleaning out your medicine cabinets, getting unwanted, unused, or expired medication out of your home. It is a preventative effort, especially for those that are at risk for suicide, to get all that stuff out of the house and take that chance away from them. And again, it's from 10 to 2. There's over 100 locations. Did I say that? There's 100 locations. That's a lot for New Hampshire, for tiny little New Hampshire. We'll be out there here in Manchester. I'm not in Manchester right now. But we're going to be giving out doTERRA bags at the location at the Elliott River's Edge. So that's another step. So I encourage you to think about that, tell everybody, and find a location and drop the stuff off. It's just drop off, no questions asked.
Hi, I'm Shamra, American Foundation for Suicide Prevention. I just wanted to share two quick things. The first is we are working with the Public Policy Council or a subcommittee to host an in-person State Capitol Day on May the 4th in Concord. That'll be from 9 a.m. to noon. We'll be discussing 988 and what we as advocates can do to continue to push those efforts, and a couple of other legislative issues as well. We'll also include an advocacy training. So really some training on how to actually have those conversations with your legislators. And the best part is that we are offering free breakfast. So you can at least go to afsp.org/New Hampshire on our events page to register for that. The second thing I wanted to share is that our chapter is hosting a Pause for Prevention and Mental Health Awareness Day on May 21st at Derrickville Park in Manchester. When I say pause for prevention, I mean your four-legged puppies, dogs. It'll be a dog walk and again, really just kind of an awareness event. It is a fundraiser, but that really isn't the point. But if you do make a $25 donation, you'll get a fun little Pause for Prevention t-shirt. And that is also on our website. If you would like to come and have a free resource table to hand out stuff and really be a part of this awareness event, we would love to have you. We can share my email somewhere. I guess you can put it on in the chat, but again, completely free. Come have a free resource table, be a part of this amazing day, and bring your dog. There'll also be a kissing booth with your dog.
Just a couple other things while we're in the public view, and I think there's a lot of times where a lot of things that the SPC does at the subcommittee level and as a group and all of your interested parties, that happens every day that nobody knows about. And I think, some things are just worth saying. In last few days by Senator Hassan, Congressman Pappas was also there. And I just want to call out a couple of things. I was very happy to see Amy Cook there. She does not know that I'm giving her any accolades, but I'm going to. Amy Cook's worked very hard for veterans, and the subcommittee that she chairs here is very important and has a lot of crossover with first responders and just a lot of special groups. She did an exceptional job, not only laying out what her duties are, but how it intersects with a lot of people. And there was a lot of great questions that came from it. And it was just one more thing that the SPC does as a group and as a membership that brings it forward and keeps it alive. And I just want to make sure that Amy gets the credit that she deserves for that. I'm also going to turn it over to my co-chair, Mary, because she was involved with something, same group with Senator Hassan, and I want to just make sure that gets noted.
Okay, well, I'm not going to go on this by myself because there's members that are on the call right now and in the room. So Wednesday, we were invited to join Senator Hassan around a conversation around youth at risk for mental health issues. It was focused, or kind of the impetus of it was a bill that she put through at the federal level, which is called Stand Up. And it's really designed at the federal level, down to the state, down to the local, to get funding that's vetted and deliberate to help with mental health issues. So funding streams will be coming and policy changes, hopefully, and some guidelines around policies. So Sham was there with me. Connors Klein was there. We had, did I just cut out? Okay. And it was a really great conversation with people with lived experience there. And Senator Hassan did a really good job. I don't know, Sham, if you want to add on to that. Okay. Nobody wants the mic. And it was really good for New Hampshire to get that conversation going with Senator Hassan, and hopefully it'll lead to things in the future for all of us. And since I got the mic, I'm just going to take the advantage to say that there is going to be a 90-day listening learning session, actually 2 of them coming up. Both will be in May, and they're going to be young people presenting to young people. 2 of our big high schools, Nashua South and Dover, are the location, and the youth, leave it to the young people. They're going to do a recording of the listening session, a separate one, of them talking about 988 and the importance of that and how to reach out and encouraging their peers to reach out. That will be available to everyone. And I think we'll at some point have it on the DHH website for anybody to view and just share it widely. Last thing I'm going to say is that we're super excited because we used some of the money that we got this year to be able to hire a coordinator for the conference. She started on Friday and she's already in action and going to meet with some of us today. So we're excited about that. Okay, he wants me to talk about the conference in general. Okay. So the conference planning team met actually on Friday, and we are getting ready to set our plenary, which is the meeting this afternoon that's taking place, and workshops. And there'll be an ask that'll come out through the notes today, wanting people to start to think about the great things that have happened during the year. If you have videos, pictures, stories, those types of things, we'll include that in the ask out for everyone to start pulling them forward for us. And the committee, our new coordinator, will be reaching out to put that together for the conference that's coming up in November.
Thank you, Mary. Much appreciated for the update. And we just want to pass it over. We're just going to go to committee updates next. So there may be people that want to give an update.
Hi, everyone. This is Deb Baird with the Survivors of Suicide Law Subcommittee. We just wanted to also share on how excited we are to have all this funding and money coming in, because we've just finished up with our Joanne Harpel workshop that we held in March, and it was a huge success, had over 42 people in attendance between both workshops, which worked out really well. So much so that some of the extra funding, we're going to be able to utilize some of her work moving forward with law survivors who couldn't attend, and maybe possibly just like go onto her website and purchase one of her licenses to be able to do some workshops separately. The next thing that I wanted to share is that because of the funding, on May 23rd, we're hosting we've spoken about this before, our Law Survivor Speaker event. We have speakers coming in through the NAMI, New Hampshire Survivor Voice Speakers Bureau, and there'll be 4, maybe 5 of them speaking on different types of losses. In other words, it could be spouse, could be sibling, could be child, in that realm. And it will be held at the Concord City Auditorium. We'll put a message out there with a link and everything to check it out, plus also get information from. So it's going to be Monday, May 23rd from 6:30 to 7:30. And basically, these speakers are going to share their story, and it will be like an open forum where people can ask and have discussion or ask questions of these speakers. That's all I have. That all you? Yep. Okay. Anyone else?
Knows that the Magnified Voices event is coming up. I don't know. It's still, we'll look into it. We're not sure you can still get tickets to go, but that's one of the things that the Suicide Prevention Council decided to use some of our funding to support that event. Notes too, if you're interested in attending that event.
Wow, there's a lot going on. That's great. Thanks everybody for the updates. Anything else before we move to close? Crystal, did you want to weigh in at all about your experience with Senator Hassan? I see that you're on.
Yeah, I thought it was a really fantastic conversation. I'm looking forward to seeing what comes out of it.
Great,
And
thanks.
that's really it. Well, thank you.
Yeah, good. Okay.
So just to make sure everybody knows, the next meeting date is going to be June 27th, and that will be a retreat, 1-hour agenda and brunch. So come in person if you can, and we'll get the details out. So I just want to give one more opportunity. If there's anything outstanding, if there's a member of the public that wants to say anything, but it's been a great meeting and wonderful to see everybody. But is there anything else? Okay, hearing nothing else, I really appreciate your time. It was a very productive, fruitful meeting, and we always like seeing everybody, and everybody here likes being with each other. So it's always a great outcome. So I thank you for that, and I wish you a great this sunny, hopefully warm day. I wish you have a great day, and thank you all for being here.